viewers, you're welcome to the Edfields Podcast, your everyday law podcast. And as I would always say, today's episode is going to be a fantastic one, and hopefully we'll seek to educate you on another area of the law. Now, it is true that many individuals are unfamiliar, or may I say ignorant, about their rights, particularly when they are seeking medical attention. And usually you would see that healthcare practitioners, a few of them, may rely on this ignorance to evade accountability in providing substandard health care. Now, today's episode seeks to educate you and inform you on what we call medical negligence and the rights of patients in seeking medical health. I would ask that you sit back and enjoy this episode. But to discuss this topic with me, we have a medical practitioner in our midst, and hopefully he'll be speaking the mind of medical practitioners in general and how they perform their duties in giving health care. You're welcome, Dr. Dazi.
Thank you very much, Doc.
And of course, this topic cannot be discussed without the help of legal practitioners. So I have with me two legal professionals to also give us some legal insight into the law of medical negligence. Angela,
Jasmine,
you're welcome to today's
thank you very
episode.
much.
And of course, we have Albert Ekokweno. You're welcome.
Thank you. I'll be looking forward to this.
Oh, good to have you then. Good to have you, Albert. Well, Dr. Dazi, we're going straight into the medical profession.
Sure.
My first question has to do with the duties of a medical practitioner.
Yeah.
I know there is a certain oath doctors would usually swear when they are being made doctors.
Yeah.
On a lighter note, I know people would say it's called a hypocritical
Hypocritical
oath.
oath. Yeah,
But I don't know how that is. Maybe you would explain that to us. But I am sure that whatever this oath is has a big role to play in the duties you perform as a doctor. So kindly give us, just outline some of those duties a medical practitioner is expected to perform.
Okay. Thank you very much, Jasmine. Like you were saying, some people call it the hypocritical oath, but there's nothing hypocritical about it.
Yes.
It's very practical, I mean, in summary, when we talk about the Hippocratic Oath, what most people know is save lives and do no harm. But it's a very detailed oath that, talks about the doctor's duties and what the patient should expect from a doctor. So we usually glean about 4 categories of the duties of medical practitioners, not just doctors, but medical practitioners, not just the doctors, like I said, but paraclinical staff, which include the nurses, radiographers, lab staff, all the people that form the medical team. And these 4 categories, I'll break them down for you. The first one is the patient care group of duties, right? This includes diagnosing and treating the patient properly. Mm-hmm. So making a careful analysis, taking a detailed history, taking a detailed medical examination, and making a proper diagnosis to be able to treat the patient. That's the first aspect of the patient care duty. The next aspect of patient care duty is patient safety, right? Making sure that your management or what contributes to your management does not harm the patient. For example, if you perform a surgery, you should be meticulous enough to make sure that you don't leave something in a cavity that you go into, right? So patient safety is very broad. That's just one example. The next aspect of patient care duty is prescribing appropriate and accurate medication for the treatment of a condition. Yes, that's the third aspect. And the fourth aspect is emergency care, right? Emergency care is in the heat of the moment when the person arrives, making sure that you keep the person alive. That's the most important thing. The next group of duties are the ethical duties, right? In ethical duties, we have patient confidentiality, we have informed consent, and we have non-discrimination, right? The next group is professional duties, right? We have professional duties as clinical staff, as medical professionals. We're supposed to continue learning. Medicine is an evolving field. Guidelines are changing every year. Sometimes I'm surprised that every year there are actually new guidelines for the same condition that has existed for hundreds of years.
Okay.
And you are supposed to keep abreast with these guidelines, right? You're supposed to know because you're supposed to offer the best care to your patient when they come. Okay. So continuous learning is one thing. Collaboration is another aspect of professional duties. We're supposed to work together as a team. I might not know everything as a general practitioner. I might not know everything as a gynecologist. I'm supposed to know when I'm supposed to involve another kind of specialist to help with what I'm managing, right? That's where collaboration comes in. And the last aspect of professional care is record keeping, making sure that you're documenting, you're keeping accurate records for the next professional to have the accurate information to manage the patient. I might not be the only doctor that manages one patient throughout their lives. The next person who might handle that patient should have accurate records to be able to continue management. And the last aspect of our duties are the legal responsibilities. We have legal responsibilities, right? We are supposed to make sure that record keeping is part of the legal responsibility. We're supposed to keep records for auditing purposes. People need to know what we have done and if we did the right thing. The next aspect of legal care is following regulatory guidelines, right? We have regulatory bodies for each kind of professional. Doctors are under the Medical and Dental Council.
Yes.
Nurses are under the Nursing and Midwifery Council. There are guidelines that we are all supposed to keep. And these form our legal responsibilities mainly. Yeah.
That's very broad. That's very broad. Thank you for outlining that for us. Now, Angela, Dr. Darzi has outlined numerous duties. I mean, once you try to break them down, you realize that there are lots.
Yes.
Duties of a medical practitioner. Now, if you can tell us what happens to a medical practitioner when he fails to perform these duties or to satisfy his role in performance of these duties.
Okay. So that failure to satisfy the duties would be termed as a breach of the duties. And if the patient with whom he was tasked with taking care of is suffering any damage or loss as a result of his non-performance or his non-satisfaction, then that's what brings us to today's topic of negligence, medical negligence.
All right.
But medical negligence stems from a thought, a wrongdoing on its own. So there's another area called negligence implicita. And that's where we have the three elements of the existence of a duty, a breach of the duty, and you suffering some damage as a result of that duty. Okay. So generally, if someone owes you a duty of care in some way, and that's not just specific to the medical field, it could be in any way. Once you've established, they
Even
have
in
that
driving,
legal
as a driver,
exactly.
there's a
He
duty
has
of
a
care,
duty
isn't
to take
it?
you to where your destination. Yes. So, but then when we come to the medical field, it's a more important field. Not to discredit the others, but it has to do with human life, has to do with life or death. And usually, I think he mentioned emergency services as one of them.
Yeah.
Yes. So it tells you the impact they have in our lives. So for that reason, their standard is way higher. It's not just any death resulting or any loss resulting from a doctor's actions that would lead to medical negligence. So the standard for medical negligence is higher. It has to be the actions of the medical practitioner you are complaining about has to be one that is not in line with something an ordinary person of his skill in his circumstance would do. Okay. So let's use Dr. Dazi, for example. I'm sure there are levels in the medical practice. Yes, so someone in your level, given the same circumstances, given the same medical history of the patient, given everything you were given, would not have made that mistake. That is what the law requires.
Okay.
So it is not just, sometimes it's a very emotional thing, and I understand. Yes. Maybe you've taken your relative to the hospital and they died unexpectedly. That on its own does not entitle you to a claim in medical negligence. But in that moment, you are emotional, emotions are high, there's a lot going on. So you have to always remember that the standard is way higher. Is it something that someone else could have prevented if he was given the chance
Opportunity to
so?
do that.
Yes. Yes, so that is basically what medical negligence is about. And while I'm on the topic of what constitutes medical negligence, I'd like to talk about what does not constitute medical negligence.
Okay, tell us. That'll be interesting.
Yes, so I think we have a common, I would say, beef with nurses where, she's not very receptive. And usually, interestingly, it's just the female nurses because I don't know, they expect them to be so welcoming.
They do it to
Yes.
us too.
Yeah.
They do it to doctors too.
Okay,
So we don't have the male
About
nurses.
that,
The
it's part of the job. See, treatment isn't just the medicines a person gets. Even the way a person is handled when a person goes for treatment, it can contribute to the person.
Okay,
Yes,
but
but Albert,
then-
she's
No.
talking about negligence and standard of care in this
yes.
regard.
Which
We
is
are
high.
talking about the legal duty. Wait, it goes, yes, it does go beyond the medicine, but then it doesn't also impose on them to befriend you and be very charming with you.
So
You
when I
see?
go to the hospital and the nurse is on her phone and is not listening to me and she has a frown on her face, I cannot say.
Jasmine, you
she's
mentioned
been-
a lot of different things. She's on her phone, is not listening to you. She's not performing her duty to you.
I
She's
see.
supposed to listen to you and take your whatever she's
But
supposed
please,
to do.
this doesn't mean
But
that the nurses should you should be nice to us.
the frown is not her duty. She's not
She's not performing
yes
her professional
she's
duties
doing
at
her
that time.
professional duty. She's not being rude to you. She's doing what she's supposed to do. It's just you expect her to smile and she's not smiling.
It's just a customer service thing.
Yes, that is not necessarily
That doesn't affect her.
negligence.
It's
Yes.
not negligence because it has nothing to do with her profession.
Exactly. It's something
I
that
see.
would have made you feel more at ease.
Okay.
But it is not something she's required to do. But where that attitude prevents her from doing her job, say because she's being rude to you, she's not listening to what you're saying, you are telling her what is wrong with you, you see, that's where the line is.
That's where the line
So
is.
the fact that she's not being charming with you does not necessarily breach that duty she has to you. Yes, that's the clarification I wanted to make.
That's nice. Thank you very much for
To
that.
add on to
at
what's-
least the nurses will be happy that they've been vindicated to some extent. Now, Dr. Dazi, I have heard that medical professionals are not to oversee patients. They are incapable of looking after. What I mean is, I'm looking at quantity.
Yeah.
I have heard. I don't know if that's true. Maybe you will just
Okay.
clarify that. For example, a doctor is required to look 1 doctor to 10 patients, the ratio. I want to know if there is a quota
Okay.
of patients a doctor is expected, or a medical practitioner is expected to oversee
Right.
when they are in the performance of their duty.
Okay, so to the best of my knowledge, in our practice in Ghana, there are no guidelines that state that a doctor should see this number of patients in a day. To the best of my knowledge, what I know is that doctors are given a certain number of hours they are supposed to do in a week.
Okay.
Within those number of hours, there's
If
no
there are 100 patients before
there's
you,
no regulation on the number of patients you should see. That doesn't take away the fact that, your work is mainly seeing patients, and the number of patients you see can affect how energized you are and the quality of your work that you offer. So nobody is denying the fact that when you see a lot of patients, it's possible that tiredness may set in and it may affect the quality of your work. But it doesn't mean that there are guidelines or strict rules or our regulatory bodies have stated that doctors must see this number of patients in a day, because when you see more than that, you may not be at your best. Even though we know that, practically that's the case. The World Health Organization has given some recommendations on what, quality healthcare means in regard to patient-doctor ratio.
Okay.
So they might say that, in order for, the standard of care or the quality of care to be at this certain level. Maybe one doctor should see this number of patients. But it's not a rule, or it's not a law. It's not part of our regulations, So there are no specific guidelines like that. You might see if you're on duty in the emergency room, for example, there is no predicting. I remember when I used to do my emergency duties, usually when it's a holiday, for some strange reason, emergencies are also on holidays. So you can't really predict how many people you are going to see. But usually Friday into Saturday or Sunday into Monday, emergency is so busy. You can't get to a point within your shift and say, the guidelines say 40 cases.
I've done my first 40, so
I'm done.
I'm calling it a day.
The challenge if something like that comes up is that you would realize some doctors or some professionals saying, my target is to see this number of people. When I'm done with this number of people, I'm closing and I'm going home. And that would be a problem.
There's a possibility that there will be a vacuum.
Exactly.
No doctor to attend
Exactly.
to
So the patient-doctor ratio thing is a recommendation to enhance the standard of care, but it's not necessarily a regulation or a certain rule that should be there, for doctors to see a number of patients in a day. Yeah.
Okay, great. Maybe I should ask you, Doctor, are there any medical guidelines that sort of allow trainee medical, should I call them medical practitioner? They're under training, but they are not doctors here. They are not nurses here. They are under training.
Okay.
Are there any guidelines that allow them to partake in real life medical treatment of a patient?
Do you mind giving me an example of what?
A typical example is I have been in the hospital and I have seen nurses who are under training give injection to a patient and trying to find a vein to, I don't know. So do you allow them to do these things in real life situations where it is a matter of life and death? And then you ask a trainee nurse to come and give me an injection?
Good. Thank you. That's a wonderful question. The one thing I remember from my training is that we were all told that medicine is an apprenticeship.
Okay.
Medicine is not to be learned in the library or in the classroom.
You need
There's
actual
a part.
real world experience.
It is an apprenticeship. You need real life experience.
I see.
Let me ask you, if you were going to take a plane and the pilot told you, I've completed, and the announcement, when you see the plane, the pilot will announce that sometimes I've seen videos of pilots announcing, this is my 10,000th flight, I'll be retiring after this flight.
And people are happy to hear that.
They're happy to hear that.
People like
now
to
just
hear
imagine that this pilot now takes the mic and says, hello, this is pilot so and so.
I
graduated about 2 weeks ago. In fact, this is my first flight. All I've done is flight simulations. I'll be guided by my co-pilot here who has more experience, but I'll be taking the flight, 12-hour flight from here to Indonesia. And you imagine, will you clap?
I'll be
Not
nervous.
many folks. So there are certain fields that are apprenticeships.
Okay.
The learning has to be done on the job. You cannot, there are things you can do on a mannequin. There are things you cannot do on a mannequin. Medical training is advancing. I've seen things around. They are learning how to make more, lively, more, mannequins that are more alive more human-like than, but it is fully an apprenticeship. The mannequin cannot, tell you, oh, no, I'm feeling pain at this point. The training has to be done on the job. Should I say that it is rather fortunate or unfortunate that the one that the trainee has to sort of use to learn is an actual patient. But that learning must be done under supervision. It is not like student nurse, go and check this, and then the supervisor is sitting somewhere doing something else. Supposed to be done under supervision. As far as I know, when I was in medical school, there was nothing. We had logbooks that we had to sign for procedures you've done. And every procedure must be signed by the supervisor who stood there and watched you do it. So yes, the regulations allow for trainees to do certain procedures that, of course, are at certain levels. The logbook for a medical student is different from a logbook for a house officer who has just finished school.
Okay.
The resident trainee who is training to be a specialist has a logbook that is different from the house officer.
Okay.
You see, because there are different procedures that each one is allowed to do within the regulations, right? But all of it should be done under some supervision. Also, not all procedures are allowed for every trainee to do. Do you get my point? Yes. So there's room for that,
Okay.
but it has to be done under supervision, and it has to be procedure dependent. It's not everybody can do every procedure. You can't take a medical student and tell them, do a cesarean section. I'm coming. I'm going to check on a patient. Even if the medical student is part of that procedure as assisting, they are not the one leading the surgery. But let's say a house officer might be asked to do the procedure I'm watching, right? The medical student will not be asked to do the procedure and let me watch. He will be asked to watch as I cut, hold this for me as I open. The house officer might be asked to do the cesarean section and let me watch. Okay, this is not how you do it. This is where you get to.
Hey,
but
this is not how you do it.
But it's under strict supervision. There was no way I could have learned how to do a cesarean section, perhaps on YouTube. If the pregnant woman came and said, okay, now I'm qualified to do the cesarean section. So how many have you done? Oh, you are my first. All the previous ones, I watched it on YouTube. Then she would definitely, it's an apprenticeship.
I think it's wonderful how surgeries are being done, and many of the patients are not awake when it's being done, because they would not know if an apprentice trainee medical practitioner is actually working on you.
I must say, let me add that this is not the case for every hospital.
Yes, I know.
There are some facilities that are
strictly go by medical.
Exactly. There are facilities that are, are teaching facilities. These are places where you are supposed to learn. It's a recognized teaching facility. When you come there, right, either by signing your consent or by knowing that it's a teaching hospital, you are supposed to be aware that in this environment, there's going to be teaching and learning, right? But there are other facilities where, if you are going to do a procedure, for example, your consent form is in a teaching hospital is usually different from another hospital. Right? It will be stated there that, in this place, there are teachers and learners around.
I see.
Yeah.
Okay, thank you. Now, Albert, maybe we should hear from you. Dr. Dazi has explained that it's important for these trainee medical practitioners to be part of the process in the treatment of patients. Now, if you can tell us who is liable for medical negligence in a situation where a trainee medical officer was in charge. I mean, he gave you an injection under the supervision of, or even without supervision. Maybe you can look at both scenarios, under the supervision of a medical professional or without. What sort of, is there a breach? Can he be held for negligence?
So from what I've seen, the law actually draws a distinction between a trainee medical officer and a medical officer who is, for want of a better word, of full age and body. So if you're a medical officer and someone is working under you as a trainee, you, the senior medical officer or the supervising officer, is deemed to be responsible for whatever it is a trainee does.
Okay.
There's a case where a child, 2 years old, was brought to the hospital. The child was brought, and the complaint was that he had wheezing when he was breathing, and he couldn't really breathe properly. When the child was brought, they took an observation, and the supervising officer, the pediatric officer who was supervising, suggested that the child just be left, but then they should keep monitoring the child over a certain period. So the nurses and the junior staff who were monitoring the child realized that after a certain point in time, the child's condition started deteriorating, and they recommended that the supervising pediatric officer conducts a certain procedure on the child. Now, this instruction wasn't followed, or this observation wasn't complied with. And then later, the child's condition got better for one reason or the other. And then the next day, the child died.
Wow.
In that instance, you as a parent, you are grieved. You are looking for who was
To blame.
who to blame for
For
this.
the death of the
And
child.
it would seem that the junior officers who were with the child, as at the time the child died, should be the ones you should hold responsible. But like in every profession, and like Dr. Dazi said, they are apprentices, for want of a better word. They are in training. So whoever is a senior officer is the one, the buck lies with him.
The supervisor,
Yes.
he deals with that. Dr. Dazi, you agree with him?
Well, yes. The truth of the matter is that in medicine, most practitioners are usually in training at some point. And there are different levels of training. There are things that at each level of training, you are expected to have, I should say, the skill to do, or certain decisions that you are expected to have the authority to take. For example, a house officer cannot take certain decisions as to, who should be admitted or who should go for surgery. You can write that this is what you think.
Your recommendation.
This is what your recommendation is. But the final decision comes with your supervisor, either the medical officer who's in charge of you, the resident, the specialist, or the consultant. So in some cases, the supervisors are solely responsible for that decision where there's negligence. In some cases, when we expect that at this level of your training, you should be able to take this decision. You should be able to, you have the authority to take this decision. You have the skill to do this procedure. If you fail to do it, whether or not you are under supervision, it becomes your responsibility.
I like that you said if you fail to do it, because for the most part, we've been looking at if the situation is one where the health officer takes a step or does something.
Yes.
There are also instances where the damage might arise out of an omission of theirs to act.
Yes.
Now, Dr. Dazi, I'm sorry I would need to put you on the spot.
Sure.
Yeah. But I have heard of situations where patients approach you in the hospital, approach medical practitioners in the hospital, and before you can give treatment, you would insist that payment is made. And this causes undue delay, which sometimes lead to other complicated issues. What's your stance on that, please?
Thank you. I like the fact that you said, what is my stance? Because I'll leave it to the lawyers to come up with the legal, implications of it.
Yeah.
Here's my personal opinion. I'm not a cashier. I'm not an accountant. I don't deal with money.
Okay.
I deal with people.
Okay.
For me, as long as, there's a triaging system in medicine. So you
Doc,
have to go
before
through.
you go on.
Yes.
Some of us don't know what triage
Yeah,
is.
let me explain that. So before you meet the doctor, you would meet a nurse who registers you,
All right.
who checks your vitals before you come to the doctor.
Oh, so that's triage.
That's triaging. So triaging mainly is a broad term. So usually triaging involves, checking vitals and determining what category of patient the person is. Is the person an emergency? Is the person an outpatient case, a stable case? That's what triaging really is. But I'm using triaging, loosely in this term.
Yeah, I get it.
Right. So for me, once a patient arrives at my point, whether it's in emergency, whether it's in the consulting room, my assumption is that whatever needs to be done before the patient comes to me has been done.
Has been done.
So my personal opinion is that the moment I have seen the person, I'm attending to the person, I'm doing what I can to make sure that the person is attended to at that point. It is not my responsibility as a doctor to be asking the person for a receipt, to be asking the person whether the person has paid. I might ask somebody, are you on insurance? For the purpose of determining what type of tests I want to do and what the limitations might be in the person's management so that I can know how I can navigate the system to get the patients the best kind of care. But as it pertains to have you paid? Okay, if you have not paid, then next patient. That's not a doctor's
Because,
responsibility.
yeah, I would also like to think doing that breaches your oath.
Well,
Does it?
to some extent, yes. But, you guys have an oath.
We do. Basically, it's like, as a lawyer, people need help.
Yeah.
That's why they've come
So
to
you
see
must
us.
always give
You
your
can't just abandon a person.
Yes. So
And health is even more serious than our situation.
I
Because
agree.
in
So
this
it has to do with
Baba,
as
let me
his
ask
life is
you. I know
concerned.
you have pro bono cases you do,
yes, we do.
but do you also sometimes make sure that the person?
I wish I didn't even do any program.
I have seen. I've not seen in real practice, but sometimes I've seen. Now they have legal shows and legal medical shows and things. A lot of people learn from medical shows. They come to
Yes.
my conference and say, I watched this show and the doctor did this. I've also watched some legal shows and I've seen a lawyer on the phone and saying, after the person has spoken, so my legal fee is this amount per hour, and this
For giving
retainer.
you this advice.
Yes, so does it also affect your oath in some way? I don't know. That's why she asked what my personal stance is. My personal stance is that I think that doctors should have nothing to do with money. I know people will take me on this. I think that doctors should not have to deal with money at all. If you need to buy, and it's controversial, if you need to buy medication, go and buy your medication. If you need to buy an implant, go and buy your implant. If there's a surgical fee, this is the surgical fee. This is where you pay it to. If the doctor is supposed to be paid from that surgical fee, that is what it is. If the doctor is charging you for a procedure and there's an understanding that, the doctor is charging you because he's the one doing the procedure, and it fits within the hospital policy, that is acceptable.
Okay.
But to the point where in emergency care, money becomes a deciding factor where somebody gets care or not. Medical professionals, in my opinion, should have nothing to do with that type of money. That's why they're administrators.
My question to you then is that where a patient fails to make payment for treatment and something unfortunate happens, do you consider that acts as a medical negligence on the part of the medical practitioner?
Nobody plans for an emergency, and that's why I think we understand. Nobody plans for an emergency. Nobody wakes up in the morning and decides, I'm going to have a stroke today, so I'm going to put money in my pocket.
True.
I'm going to have my ATM ready, and then when it happens, I'm going to take money and then I'll pay for it when I go. Most of the people that come in when they have an emergency, in fact, they had not planned for that emergency. They probably didn't have money on them.
Yeah.
It probably happened on the way to work. It probably happened in public transport. It's not at that time when the person has had the emergency that we are saying, maybe they were brought in by
How
a
much is in
bystander.
your bank account?
You were brought by a bystander. You are saying the person should pay before. So I like the fact that you said it's a case-by-case basis. I mean, I know for the administrators, the finance people, if somebody walks into the hospital, the person is stable or assumed to be stable, at least the person should be able to pay for the service before it's rendered. But in emergency cases, my opinion is that keep the person alive,
Yeah,
at
save
least
the life
up until
first.
the point that
And then consider all other
exactly.
variables.
Okay, that's great. Angela, we have looked at situations where you can say a medical practitioner has breached his duty. There's another area under medical negligence, which we often will refer to as negligent nursing.
Okay.
I believe you've heard that
Yes,
before.
yes.
If you can just educate us on what negligent nursing is and what we're expected to know about it.
Yes. So, negligent nursing, simply put, is that your duty is to provide nursing, the act of nursing, and not just to provide a nurse. You see, there's a difference if you think about it. So, I'll give you an example. A pregnant woman has come to you to have her baby. If you are providing a nurse, their job ends after the baby has been delivered, because I'm here for a particular purpose. You are pregnant, you are having a baby, your baby is delivered. But if you are providing nursing, it goes beyond that. After the baby is delivered, they are in your care, because she's not in the position to do whatever for the baby. and then you are the one with, what will I say, medical knowledge of, say, if this is happening to the baby, this is what I should do. If this is happening to the baby, this is what I should do. So that's the difference. So, as I said, the position of the law is that you are under a duty to provide nursing and not a nurse.
Okay.
So it's not just the existence
You must
of
provide
the
the
medical
service.
practitioner. Yes,
Yeah.
it's the service
Service.
they are providing.
Okay.
So there's actually a case where there was a baby brought into the hospital. I think she was either 2 or 6 weeks, just a few weeks old. The baby was under the care of, well, the hospital disputed it, but I am saying the baby was under the care of the hospital because it's a baby. She can't move. She can't do anything for herself. And the baby got missing.
Wow.
What?
Yes. So the thing was, because it was just a few weeks old, the mother had to be in the hospital to feed the baby periodically, when the nurses tell her to feed her and things. But then the baby was in a special ward and the mother was in the kitchen. So when it's time to feed the baby, the nurses direct the mother, okay, it's time, feed her. It was a girl. Feed her from this time to this time. She does that. So I think they were there for a couple of weeks, about 5 weeks. The baby was detained for about 5 weeks. And then one day, the nurse was making her rounds and realized the baby was not in the court. Went to ask the mother, have you come to pick the baby to feed her? She said, no, you tell me when to feed her and I
My
feed her.
goodness.
So then they couldn't find the baby. So then it went to court. And the position of the hospital was that they provided the
delivery.
it wasn't even about the delivery.
of
It was about they provided the health needs of the
the
baby.
baby.
So the fact that the baby is missing, it's not
It doesn't fall under the ambit.
exactly that there was nothing wrong with their security system, for which reason they can say that, oh, your security was faulty and that's why, and after all, the mother was around. And the court said that the baby, for lack of a better word, is just an inanimate object. It's like a chattel. So the court likened it to the Bailey relationship, which I know. Okay.
It's a bit technical.
Yes. But basically, the court was of the opinion that the baby is an inanimate object. And looking at the circumstances of the case, as Albert said, it's on a case-by-case basis. This particular circumstances, the mother did not have control over when to pick up the baby, when to see the baby. So if it was that case, then you could have said you had access to her. So I don't know when.
But this was regulated by the hospital.
Exactly. It's your staff, it's only staff of the hospital that had access to the baby and that could give access to the mother. So then if we are looking at nursing, negligent nursing, this is a classic example because the fact that you have provided for the health needs of the baby doesn't mean it ends there. If the person is in your control and custody, then you have a duty to nurse them.
Wow, thank you. Well, viewers, this is all time will allow us to discuss on medical negligence. I would want us to leave it here for now. Definitely, we're going to have
so much more we can discuss.
That is it. Definitely, Albert. I'm looking forward to having a second episode to conclude. We have other matters to discuss. We are looking at patients' rights and other things. You know, Dr. Dazi gave us duties of a medical. If you look at the broad areas, I think there are lots of other things we can talk about. So definitely we'll be here for a second episode on medical negligence and the law governing this area. Now, I want to thank you for being with us. Thank you for watching. I believe you've been educated on what even medical negligence is and what to look out for as you seek treatment. And I want to say that this area is very important because you never know when you would go to a medical facility to receive treatment, or treatment will be received by a family member or a friend of yours. So look forward to our next episode. I will also encourage you to subscribe to our YouTube channel, and I will be expecting comments and questions if you do have them. So thank you for watching, and I'll see you next time.